let's start by defining what irritable bowel syndrome, or IBS, is, as much of the research surrounding a low-FODMAP diet has been on IBS and other related conditions. IBS is a chronic condition characterized by symptoms of diarrhea, constipation, flatulence, bloating, and abdominal pain. The disorder is classified by whether either diarrhea or constipation is predominant. So there's IBS-D and IBS-C. The prevalence of IBS on a global scale is estimated at about 10 to 20%, with women and people under the age of 50 experiencing higher rates of IBS diagnosis. The onset of IBS is often preceded by an episode of anxiety and depression or adverse life events. The main features of IBS include visceral hypersensitivity, altered gut motility, altered gut microbiome, and enhanced communication of the gut-brain axis. Visceral hypersensitivity describes the experience of intense pain in the abdominal area. Individuals who have visceral hypersensitivity experience extreme discomfort as a result of changes in pressure in the abdomen, such as in the process of bloating. Altered motility describes the process by which the gastrointestinal muscles react to digestion. Individuals who have altered gut motility experience abnormal intestinal contractions and may have either experienced constipation or diarrhea as a result. The gut microbiome is a community of microorganisms that live in the gastrointestinal system. The gut microbiome differs from individual to individual, depending on many factors, including diet and lifestyle. However, some individuals with IBS may experience gut dysbiosis, or a microbial imbalance in the gastrointestinal tract. An altered gut microbiome may influence symptoms of IBS. The gut-brain axis describes the connection between the emotional and cognitive centers of the brain and the intestinal functions. In IBS, enhanced biochemical signaling occurs between the gastrointestinal tract and your central nervous system, the brain and the spinal cord. An altered gut microbiome may also play a role in this relationship between your gut and your brain. It is not entirely known why some people develop irritable bowel syndrome. Hypotheses include small intestinal bacterial overgrowth, which is also known as SIBO. This describes a condition in which there are excess bacteria in the small intestine. SIBO can arise from many conditions, but usually the development of the disorder is complex in nature. Chronic intestinal inflammation can also lead to IBS. Visceral hypersensitivity, again, this is severe abdominal pain, can contribute to IBS. And genetic factors may also contribute to the development of irritable bowel syndrome. Because individuals each experience a wide range of symptoms in a chronic manner, treating IBS can be difficult. The main approaches include drugs, therapy, probiotics, which is a newer approach with limited evidence, and also dietary approaches. An individualized diet should be the first approach to treating IBS due to the lack of side effects and potential efficacy in relieving symptoms. Common dietary approaches include consuming more soluble fiber. Soluble fiber is a kind of fiber that attracts water and creates a gel in the gastrointestinal tract. Soluble fiber is found in foods such as oats, barley, nuts, beans, lentils, and seeds. Consuming more soluble fiber can promote healthy GI function. Eating small meals throughout the day is another dietary approach, as well as limiting caffeine, alcohol, high-fat foods, and limiting spicy foods. However, there is no strong evidence that these practices constitute an effective treatment method. Dietary approaches to treating IBS are very individualized, which is why it's important to work with a credentialed healthcare professional who specializes in the treatment of IBS. Up to 89% of individuals with IBS have identified specific foods that trigger IBS symptoms in as soon as 15 minutes to 3 hours. Following a low FODMAP diet for a short period of time is one of the best ways to identify these triggers, as upon completion of the low FODMAP elimination phase, you begin introducing foods along with the advice of your practitioner and noting which foods trigger symptoms for you. The FODMAP acronym stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. All of these are different forms of carbohydrates that, with normal gut function, are easily digested. However, in individuals with IBS or other related conditions, these carbohydrates tend to ferment in the gut. Significant discomfort results from both the gas released by fermentation and the intense abdominal pain or visceral hypersensitivity that those with IBS may experience. Researchers at Monash University in Australia first proposed that by restricting consumption of these fermentable carbohydrates, individuals with IBS may be able to reduce their gastrointestinal symptoms. Since then, it has developed into a new dietary approach for individuals with IBS. So let's take a look at why the low FODMAP diet might work for IBS. First, let's review how food is digested and absorbed in the GI tract. Food enters the mouth and travels through your esophagus and into your stomach. It then hits the small intestine, also called the small bowel. At this point in digestion, food has been broken down into smaller particles. The small intestine is where most of these nutrients are digested and absorbed. What is left continues on into the large intestine, also called the large bowel or the colon. The colon is responsible for reabsorbing fluid and some electrolytes. Undigested matter moves through the colon and is expelled through the body. So you can imagine, if these fermentable carbohydrates are not fully digested, how they could impact your small intestine and your large intestine. These undigested carbohydrates ferment to produce the symptoms that we've already covered, creating an overall irritable and inflamed bowel. You can now move on to the knowledge check for this lesson.